Hi everyone, Dr. Bruce here. In this video, we're going to take a look at the cranial nerves. So there are 12 pair of cranial nerves, and they use Roman numerals to designate the cranial nerves. Some of these originate from the brain, but most originate from the brain stem. Let's begin with the olfactory nerve. This is a sensory nerve carrying the sense of smell. The fibers of the olfactory nerve originate in the nasal cavity, then they move through the ethmoid bone, the cribriform plate, into the areas of the brain that process the sense of smell. The optic nerve, also a sensory nerve, carries impulses for the sense of vision back to the occipital lobe. Next, we have three nerves, the oculomotor, trochlear, and abducens, cranial nerves 3, 4, and 6. These work together for eye movement. So for these nerves, we test these with a test called the H in space. So the evaluator stands in front of the patient and then draws an H in space, and then the patient follows that with their eyes, but they don't move their head. Next, we have cranial nerve 5, the trigeminal nerve, which is a mixed nerve because it carries both sensory and motor information. It carries sensory information from the face, and there are three areas on each side of the face that are innervated by the trigeminal nerve. So there's an upper area above the, like in the forehead area, there's the cheek area, and then the jaw area. So in order to test that, you would take something like sharp or dull and then touch these 6 areas of the face and see if the patient can feel it. The motor portion has to do with the chewing muscles, or what we call the muscles of mastication, which are the masseter and temporalis muscles. Next, we have the facial nerve, another mixed nerve. It's motor to the muscles of the face, so we test that with having the patient do different facial expressions, so muscles for facial expressions, and then it carries information with regard to taste from the anterior 2/3 of the tongue. Next, cranial nerve 8, the auditory or vestibulocochlear nerve, carries information with regard to hearing or sound and balance and equilibrium. The glossopharyngeal nerve, cranial nerve 9, another mixed nerve, carries sensory information with regard to taste from the posterior 1/3 of the tongue. Has to do with swallowing as well, so there are some muscles of the pharynx and the larynx. Cranial nerve 10, the vagus nerve, this is a big parasympathetic nerve, so it carries impulses for the parasympathetic nervous system. Sometimes it's called the wandering vagus, so it wanders through the body. Fibers leave the vagus nerve and innervate the various organs. Again, primarily parasympathetic impulses. Cranial nerve 12, the hypoglossal nerve, this one is motor to the tongue, so it's tested by having the patient do tongue movements, like stick your tongue out, move it to the right, move it to the left, and so on. Cranial nerve 11, the spinal accessory nerve, is motor to two particular muscles, the sternocleidomastoid and trapezius muscles. So that one is tested by having the patient turn their head against resistance and then shrug their shoulders. All right, so hopefully this has helped you and you've learned something about the cranial nerves. Thanks for watching and see you next time.